So welcome everybody to our webinar with me, Ellen Krupe, Dr. Wagner, and with Mari from Habit Aware. We're going to be talking about self-soothing versus self-care. What's the difference and why should you care? And we're all going to introduce ourselves. And so I will start and then I'll call on the two of you. So my name is Ellen. I work with Habit Aware. I'm also a mom. I'm also a daughter. I also am a trickster. And for those of you who don't know what that term means, someone who has trichotillomania, we call ourselves tricksters. And I have been in recovery for about 2.5 years now, which is just so awesome. And what recovery means to me, so you guys know out there, is it's not being pull free. Recovery for me is pulling less. And so I can proudly say that I'm about 95% pull free. And I have really strong awareness so that I'm able to know when I'm pulling and then decide, do I want to continue or do I want to stop? And I've been doing a series of webinars and conversations with different people. And I'm so delighted to have Dr. Lily Wagner with me. She had sent me a shout out about Habit Aware when she was doing a podcast, and then sent me that podcast, which was so awesome. I listened to it like 3 times. You had such good advice. So I asked her if she would do something with me. So Dr. Wagner, why don't you just tell us a little bit about yourself?
Sure. I am a psychologist in California. I'm licensed in California. And I'm also an international health and behavior coach. I have a lot of health coaching certifications. I specialize in PTSD and trauma, and I have a certification in EMDR therapy, which is eye movement desensitization and reprocessing. And I'm also a clinical trauma professional, a clinical anxiety professional. What else do I do? I am a mom of a fur baby, so I have a little dog that is my grounding tool. I personally have the onychotrilomania, which is nail picking, which I've had ever since I can remember. And I had the skin picking, but now it's just predominantly nails. And yeah, I found, I don't even know how we got together, Ellen. I got something like a discounted coupon about getting this, and it sounded so, I said, this is the coolest thing. I wish I had this when I was younger. And so now I got 2 of them that I wear, and I'm training myself, and it seems like some of my nails are growing. Now the next training for me has to be my toes. So, you know, it's cool.
It's a journey. It's a journey. Oh, yeah. Thank you for sharing that. Yeah, I reached out to you. I think I just did a cold outreach just to share with you as a therapist. Yeah. Here, do you treat these kinds of disorders? And not only did you treat them, you could, which of course I didn't know, you could benefit from it, which we'll talk about as we get into this, how many people have BFRBs. And Mari, welcome.
Hi, thank you. So I'm Mari, I'm a team member at Habit Aware. I do a lot of the graphics, a lot of the behind the scenes stuff, so you don't normally get to see my face anywhere. This is kind of a fun, exciting experience. But I'm just acting as the moderator today, so I'll be in and out, watching the chat, doing what I need to do.
And we're so glad that you're here. And that's right. If anybody has any questions, please do put them in the Q&A section in the chat. And Mari will throw the questions to us and we'll do our best to answer them. Yeah. So let's dig in. So today, our agenda, we're going to talk about what are BFRBs and what they're not, because that's equally important. We're going to also talk about self-soothing versus self-care. And I know that's why you guys have all signed up to be here today. And of course, we're going to answer your questions. And some of you are really kind enough to give us some questions ahead of time, which I've included in here. But please do feel free to chime on in and pop in a question into the chat. So what are BFRBs? BFRBs, and I'm actually going to get out my definition here. BFRBs stand for body-focused repetitive behaviors. That's the umbrella term for hair pulling, trichotillomania, skin picking, dermatillomania, and the one I can never say for nail biting and nail picking.
Onychophagia.
Can you say that one more time?
Onychophagia.
Onychophagia. Onychophagia. Awesome. Thank you. And these involve the irresistible urge to pick or pull or bite one's own skin, nails, or hair from the scalp, from the eyebrows, from the eyelids, and other parts of the body. And what makes it a disorder is when the person who has it, because everybody picks and everybody pulls, but if the person who is picking or pulling or biting wants to stop, has tried to stop, and has been unable to decrease the behavior, that's when it becomes a diagnosable BFRB. And now, according to the TLC Foundation, who is the leader in the nonprofit leader in this world, 1 in 20 has a BFRB. That's a lot of people. And in my world, even though I work so much with people, of course, through Habit Aware, I really do think it's probably higher because these disorders are all self-reported. And we also need to remember too, that there's different severities or levels, just like anything. You can have mild allergies, moderate allergies, severe allergies. You can have the same thing with a BFRB. You can have mild, moderate, and you can have severe. These disorders tend to have onset in pre-adolescence for girls right before puberty. That's not always the case, but primarily it happens at a young age. But there are, of course, situations when you can, your BFRB can present as you get older. And we really don't know what causes it. There is some theories that talk that it's probably hereditary and genetic. It's not always, but in a lot of cases it is. And Dr. Wagner, is there anything else you want to add to, what BFRBs are?
Yeah, and just a couple of more that maybe people aren't aware of is the rhinotilexomania, which is actually nose picking, like incessant nose picking. And there's also the cheek biting, which is called morsicatio-buccarum. You don't have to remember all that. That's outrageous. And I actually have been working with a client that has ear picking. So she digs into her ear canal constantly thinking there's something in there. And some of these, as far as the etiology of how these came about, why do we have them? There's definitely possibly genetics, the DNA in us, maybe ancestral that comes from it. But high anxiety is also part of it, as well as possibly environmental and the foods we eat. Maybe all of those combined together could possibly be the reason why we have it. It would have been great to have like ancestral research to see if like 200 years ago were these problems apparent or not. We don't know. Maybe someday we'll have information about that, or maybe through reading books or other people's journals way back then we'll know that there are some. But I would imagine at some point these started developing more, maybe in this day and age where we are bombarded with a lot of stressors, as well as just being idle too, because we don't do a lot of outdoor work. We're not out gardening, we're not farming, we're not doing things to bring in our own food. So that's why I think we may have an issue with a higher anxiety and stress level. So now we're like doing things to ourselves. It's interesting. I wish there was more research, and I'm sure hopefully in the future there will be more research about it.
Yeah, and that's a good point. I'm glad you brought up all of that, because the main ones are hair pulling, skin picking, and nail biting that we tend to focus on. But you're exactly right. It's really any repetitive behavior that you're doing to the body. It doesn't always have to be done with the hands, because it could be done with the teeth to the cheek, but it's any repetitive behavior that you want to stop that you're unable to stop is a BFRB. And also, well, let me flip over here to what they're not, but BFRBs are, before I get into what they're not, they're a self-soothing behavior. We are doing them. Most people who have a body-focused repetitive behavior, there's two types, and we usually do both of them. There's focused, where you know exactly what you're doing. You're getting those tweezers out and you're going in the mirror and you're going for the skin or the eyebrows. Then there's also the automatic, where you're unaware. You're at your desk and you're working and you start to play with your hair, and then all of a sudden you pull one out and you pull two out and you pull 20 out. So there's all these automatic as well. And they tend to be self-soothing coping mechanisms for boredom, for stress, for anxiety, also for concentration. I find now that I have my awareness that I tend to go for this part of my hair when I'm concentrating. And you might notice too, just when people are doing something and they're lifting something really heavy, you know, they put their tongue on the side of their cheek. You know, people can do that just for concentrating. So BFRBs are really self-soothing coping mechanisms. What they are not is they are not self-harm. They are not self-punishment. They are self-soothing behaviors. I can't say that enough. And the reason why this matters is because the treatment is different. The treatment of a BFRB is going to be very different than someone who might be cutting or someone who has OCD. A lot of times people believe that a BFRB is OCD, and it's not OCD. It does fall under the category of OCD and related disorders, but it's not OCD. And the reason why this is so important is the treatment is different. And lastly, it's not your fault. I know a lot of times I will talk to people and they'll say, it's my fault. Why? It's my fault. I can't stop. It's my fault. I'm doing it to myself. And it's not our fault. If I need eyeglasses, I wear contacts. Is it my fault? Of course not. My mother's diabetic, type 1. Is it her fault? Of course not. It's not my fault that I have a BFRB. And I think I do want to back up to the OCD part. And I wanted to ask you, Dr. Wagner, to talk a little bit about that. Because I know a lot of times people will say, well, I just have OCD. And you might have OCD. You also might have a BFRB, just like you might have allergies, but you also have a cold. And they're just treated differently.
Yeah. So your question is to differentiate, like talk about a little bit about the OCD.
Yeah, just a little bit of, sorry about that.
No, that's right.
Talk a little bit about the main difference between OCD and BFRBs, because the treatment is different.
Right. So OCD is more of a, I look at it as more of a cognitive system where you have these little rituals and rules in order to prevent something bad from happening. While a BFRB is really just a body focus. Oh, I have this little thing on my nail. I'm just going to pick at it because I don't like it there. And both of the OCD and BFRBs, they are what we call ego dystonic. I mean, it goes against our values. We don't want to do these behaviors. Somebody with obsessive compulsive disorder who's constantly checking the door maybe 50 times before they go to bed doesn't want to do that. So they are both ego dystonic, and we are unhappy with these behaviors. The difference is that the OCD, again, it's a cognitive thing, while I look at BFRB as just physically, we just like have this need to pick at something on our skin in order to maybe get rid of it because we think it's just an annoying thing that's there, or it's just we don't think it belongs there, whatever the thought process is. And definitely we have different treatment modality for each of them, different medications for each of them. Unfortunately, for both of these, the medications aren't 100% effective. They don't work on most people, so it's kind of a complicated diagnosis. And one of the things I do want to mention, and I hear this a lot, is like, oh, people throwing out the OCD. You have OCD, you have OCD. Just because you're neat does not mean you have OCD. Because there's another diagnosis called obsessive compulsive personality disorder. So if you're a little bit too much on the neat side, where it's like, oh, I have to have these colors in order. If not, I feel uncomfortable. I can't stand it. My anxiety rises. That's more of a obsessive compulsive personality disorder. OCD is a really, really major disorder where it just takes up so much of your day, so much of your time, because you're either checking, rechecking, or you're consumed with those thoughts, the obsessions, and now you're trying to find a compulsion to do those obsessive thoughts or the behaviors that you have. So yeah, I mean, both of these are very fascinating. There are definite treatments for it. We just have to be mindful and be consistent with the use of the tools and techniques that we will learn.
Yeah, that's perfect. I'm so glad that we took a deeper dive into that. And like you, people use OCD as an adjective. I'm so OCD. And that really, it's like fingers on a chalkboard when someone says that.
Right.
Someone might say, I can't stand it, I'm going to pull my hair out. Like, you know, people will, you know, we don't want people to say that. So let's go into a deeper dive on self-soothing versus self-care. And when Dr. Wagner and I were planning this webinar, I kept thinking about self-soothing being the behavior I do, which is where I'm stroking or playing or pulling with my hair to soothe myself. But there also are healthy self-soothing. And of course, there's self-care. So would you, Dr. Wagner, go through the differences for us?
Sure. So I look at self-soothing as an immediate gratification kind of a behavior. So I'm feeling uncomfortable. What can I do to soothe myself at this time to not feel that discomfort or that pain that I'm experiencing? So it's that very immediate thing, and it could be healthy or unhealthy. Some of the unhealthy ones, of course, is what we're doing to our bodies, hurting our bodies by picking, pulling. Other things for unhealthy self-soothing are like drugs and alcohol, overeating, gaming, porn, anything that is done excessively to the point where, again, it consumes too much of your time or it's causing problems within your relationships or your work or your concentration, and you're constantly doing it. And another good example of a possibly unhealthy self-soothing is procrastination. And that's just a way of trying to escape whatever that discomfort is. Like, I need to do this, but I really don't want to do this right now. So I'm just going to sit here and not do that because that, whatever that task is uncomfortable, or it's causing me distress, or it's causing me anxiety. And while self-care, I look at this long-term thing. So as self-soothing is a sprint, self-care is a marathon. It is something we do, a routine, routines. It shouldn't just be one thing. Self-care involves a lot of variety of habits and routines that we incorporate into our daily lives consistently to create a healthier lifestyle. Self-care could include journaling, and that could also be self-soothing. You can journal instead of grabbing a cupcake. Self-care has to do with like exercise, making sure you're eating good, making sure you're getting enough sleep and rest, having a nice work and life balance, getting out there and into your community, maybe socializing, taking care of yourself as like as a overall well-being that you want to obtain. So that is the difference. I see self-soothing as a sprint and self-care as a marathon. Self-soothing is that quick, immediate response to taking care of what's happening in the moment, and self-care is a long-term kind of taking care of what's happening. And then there's so many various healthy self-soothing techniques and tools and behaviors that we can incorporate. For example, just by thinking about if you're biting your cheek, maybe grabbing a nice cold glass of water, or having something yummy to try, maybe having hard candy in your mouth instead, to try to stop that behavior. Those are like better techniques than what we do as far as cheek biting, let's say. For me, and is this okay for me to share my little bucket of joy?
I love it.
I have this little bucket and has all these little gadgets. So the fidget toys that we talk about, right? One of the things we also want to do is become very mindful, and that's part of self-care as well. So if you can do the M&M, which is I call meditation and mindfulness, or meditation and movement and mindfulness, so 3 M's, this is going to retrain your brain. And exercise is a great way to get your wiggles out of your body, because a lot of times, because of our industrialized society, we sit a lot and we're not moving. And the body has to deal with all the stressors and anxiety that comes in. And the only way we can move at our desk is maybe I'm pulling my hair, maybe I'm pulling my skin. While if we were moving, now your body's able to allow that release of the stress and anxiety. So yoga is great, Pilates is great, Tai Chi, any kind of martial arts, running, anything that you can think of, dancing. These are the kinds of things we want to incorporate, because it also relieves a lot of any kind of potential past trauma or present trauma that you've had. And it's a part of the somatic therapy. That's what we call it, somatic therapy, for any anxiety or traumatic issue that we're dealing with. Get it out of your body. the other thing is, so in my little bucket of joy, I have tactile stuff, right? This is a bookmark I bought years ago, but it's so super soft. So if I don't have my dog around me to pet, then I will, you know, touch this. It's so soft. It just is such a warm and cuddly feeling for me. Another thing is, of course, the stress balls, right? You can have two if both of your hands need to be worked, or I like to just throw the ball back and forth.
Yeah, that's a good one. I do that when I'm watching TV.
Yeah, it's perfect. Yeah. It's wonderful. And it's also, guess what else it does? It does bilateral stimulation. Bilateral stimulation is a part of EMDR, eye movement desensitization and reprocessing. It's amazing how this actually does stuff to your brain, and it helps you process things without you even having to think about it. It's fantastic. I have a Rubik's Cube, of course.
Because everyone needs to have a Rubik's Cube.
Yeah, right? And then there are these little other things. They're just called fidget toys. This one is, you know how you have those bubble wrap things where you just click on it? So this one does that. So you can just play with your fingers and just push it as if it's a bubble wrap. There's the Tangle toy where you can just play with it, move it around. Fidget spinner, of course.
Yeah, I love
and little puzzles, you know, those, what do they call these? I forget the name of these. There's a specific term for them, but this is these metal puzzles that you can play with to try to undo or redo. And of course, if you're a nail picker, it's very good to have your lotions, cuticle strengthener, all of these that you can use and just massaging your nails. Exactly. And anytime, you know, if you can be mindful and focus on your senses, like having a wonderful scent. So I use essential oils, and this is my orange one. It's very energizing. It brings you back to focus. If you can have a certain taste that you like, I like crystallized ginger, little bits and pieces I'll put in my mouth. And again, it's like, let's focus on our senses. These are great self-soothing and quick techniques that you can utilize in order to bring yourself back to the present. Because when we're doing the automatic, the unconscious kind of picking and pulling, we're just like that's a different world, right? Yeah. But if we can be mindful and bring everything back to the present and say, oh, you know, I have this bucket and I have all these little things, let me play with that instead. Or let me focus on my breath instead. Let me get up and walk around a little bit, maybe do a yoga pose, maybe do some Pilates, leg lifts or whatever you need to do. But all of these techniques and skills are healthy self-soothing behaviors that you can incorporate. And of course, you know, using our brain training little gadgets here, you know, the bracelets, the Keen bracelets, to start training the brain at the same time is a great way to move into a healthier direction of well-being for ourselves.
That's great. And you know, I'm so glad you got into such depth with that, because again, sometimes I get caught up in the self-soothing is negative, but it's not. Self-soothing is necessary. Healthy self-soothing is necessary because we need the sprint and we need the marathon. We need the quick and we need the self-care that we do every day to nurture our bodies. Every day we need food. Every day we need water. Self-care is essential care.
And the key is, the key is to work on it when you're not anxious also. Yeah. Because it's hard to get into your mind thinking I could do this if you haven't even practiced it. So you do it just when nothing's going on and you're calm and everything. So you know there's a go-to, and remembering your go-to, like having, and I think I said it in my other podcast, it was like, pick 20 things that you think you could be pretty consistent with, that you like, and then out of those 20, pick 10 that you know for sure, I can remember these and always have that go-to, so that I know when I'm feeling anxious, before I even get to that level of picking, I could do these things first to get it out of my system first.
And I love that, because then it's already, either you remember it or you write it down, and you can even have it on a little card and put it in your wallet, or put it on, take a picture of it and put it on your phone. And when you start to feel that physical feeling of whatever it might be, the prickles in the back of your neck, the pit of your stomach, whatever's happening, it's your cue to then go, let me look at my list. You don't even have to think. You just have to look at the list. And that'll remind you, oh yeah, I'm going to play with. I love pencil erasers, so I have them everywhere.
Perfect.
And speaking of the Keen bracelet, so just to take a moment on that, you know, what Dr. Wagner showed you is our tools. They're self-soothing tools. And the Keen bracelet is a tool. I like to say it's a screwdriver. You know, in order to get a screw into or out of something, you use a screwdriver. It's a tool. It makes it easier, but you have to use it. And what this does is once you have it trained properly for your specific gesture, so this is mine, then it will just gently vibrate to bring awareness. And again, the tool is awareness to make you aware of where your hands are. And what's so nice about that is I've associated, and I know we talked about this, Dr. Wagner, and Mari knows about this too. We decided the vibration is a hug on your wrist. So it's a hug, taking the automatic or the focused from my lizard brain and putting it in my prefrontal cortex, and now it becomes a choice. And it's a hug saying, hey, Ellen, your hands are not where you want them to be. High five. You're training your awareness muscle. Instead of, which I did for 40 years, what's wrong with me? I'm a loser. I suck. I'll never be able to stop. And that's not where we want to go with anything. And someone had a question that I'll bring up now is, how do you control things even without the bracelet? This is just a tool. It's just an awareness tool. You can find awareness by putting an elbow brace on. Might not be as elegant, but it'll help you feel when you're bending. You could get jangly bracelets. You could do other things. This just happens to be easy and it's elegant. And when you get that vibration, to mind shift that you are amazing. And then Dr. Wagner has her pack of joy. What I also say is pause. Just pause for a moment. It gives you that moment of pause. And I created what I call a pause pack. It's a baggie, and it's filled with my favorite things. So I have a fur ball that I love, just like you have your bookmark. This is my fave because I can run it on my skin. And then I have, which is already on my wrist, I wear all the time, are hair ties. And what I love about these teleties is they're pretty. They can fit on your wrist nicely. And they come in different colors. And they have a little plastic thing that you can just worry around if you want to play with it. And then you just have to figure out what brings you joy. Right now, rubber bands bring me joy. I don't know why, but they do. And I have an orange little thing I found around the house that's fun to play with with my fingers. But just like we have these pause packs and we have these self-soothing, healthier tools, our hands are always with us. Our skin, our teeth, our hair, our fingers, they're always there. We can't put them away. But we have two other really good organs that are always with us, or muscles. One is our lungs and our breath. So building self-soothing and turning it into self-care, you can create a ritual or a quick process where every time you sit down at your desk, you take a deep breath and you reset. Or when your vibration goes off, you reset. Or when you feel that pit in your stomach, you reset. And your brain is always with us. Our brain is we're a really strong, great muscle. And one of the things I like to do is just take my brain and notice my bum in the chair and just feel grounded. Or put my feet on the ground and feel grounded and notice my feet. It takes away from noticing my hands. And building in those practices can be a combination of self-soothing that are healthy, as well as building in self-care. So try it. Everybody right now, out there, take a long, deep breath and see how that feels. And I want you to feel your bum on your seat. So I also want to chat a few minutes about a really important question. And this question is asked.
Ellen,
yes.
Before we move on to the next thing, can I ask a question from the chat? So someone was wondering if we could have a write-up of all of these tools and strategies sent out to the attendees.
The answer is yes.
Amazing.
And Mari will hold me to it.
That's very true.
So take good notes, but yes, absolutely. And we also are recording this for the attendees, and we will, once after it's recorded, we will also send that out too. So thanks, Mari.
Awesome.
So this is something that is so important. And I have been and this is transcends just BFRBs. This isn't just for BFRBs. Why can't I stop? It's language, people. We really have to change our language. And I encourage everybody, and I want you all to write it down. Why can't I stop and put an X through it? And change the question to, how can I manage my BFRB? It's a powerhouse question. And it's also a normalizing question. How can I manage my BFRB? How can I manage going to the grocery store? How do I manage my job? How do I manage my kids? How do I manage my work? How do I manage Zoom? Everybody has to manage things. And we're not going to do anything 100%, ever. And that's okay. If we feel good 80% of the time, that's a win. So thinking about how can I manage takes the pressure off of why can't I stop? Because everybody picks and pulls a little bit. And it makes you rethink about what are some of the things I can do to manage. Oh, I can make a pause pack, or I can make a bucket. Oh, I can use my breath. Oh, I can feel my bum on the chair. How can I manage?
I agree. And I also think that self-talk is important in all aspects of our lives, because that when we get to our automatic negative thoughts and our automatic negative self-talks, like, oh, I suck, and I can't do this, what's wrong with me, which is like the worst question you can ask yourself is, what is wrong with me? Let's focus on what's right with me and what can I do to change. We have choices, we have options, and we need to allow ourselves to recognize that we have those options and choices, and sit and figure out, hey, maybe I could start doing this, and maybe I could figure out what other ways I can change behavior, and what is my motivation to do it, and then list the things that you want to get at by changing the behavior. Because if we don't know, and if we just say, well, just like, oh, I just want to lose 10 pounds. Well, what is the reason for it? Because just saying I want to lose 10 pounds, what does that mean to your brain? Absolutely nothing. So it's all about how we can manipulate our own brain. And our brain is fantastic. It's a wonderful powerhouse. And if we know how to manipulate and give it its options and the love and tender care that it needs, then it could provide us with so much more than we could ever imagine. So that's all it is. I mean, it's just shifting the mindset, shifting how we talk to ourselves with care and loving kindness. That's such a huge key in moving forward. And one of the techniques I like to use, and I often ask people to just take out a picture from their past, take a picture of when they felt their best, and then take out a picture of themselves when they were a baby or when they were little kids. And how would you want to instill, this time when you were feeling your best, how you want to incorporate that and bring it back into your life? What was different then from now? And this is the same person. So how can I bring that same person back? I have one picture of me. I was at like a music festival, and I was like, I look good, I felt good. And I look at that and it's like, that's the same person. What was I doing back then? Let me incorporate exactly what I was doing back then. And what was the self-care I was doing? Let me utilize that. And as well, when you look at pictures of yourself when you were a child, it's like, what does that little child in me need? What do I need? Because we still have that little girl inside of us or little boy inside of us that needs care. And sometimes these stressful moments come from that, whatever it was that happened back then, maybe it wasn't attended to. Let's provide that for us. We can totally re-narrate everything and change how we think about the present, and the past doesn't have to follow us.
I love that. That is the bomb. Like, we could end right now. I mean, that was really, really good. And sometimes maybe what you do is take all that good stuff you just said, and maybe you add it to your pack. And sometimes we have to fake it. And if we don't feel good, we just still need to say, success breeds success, movement breeds movement. Action comes out of motivation. Motivation breeds action. So if you're feeling a little down for whatever reason, just maybe you think of one good thing, which is then going to lead to another good thing, which is then going to lead to another good thing. It's like the gratefulness list. I would write down 10 things I'm grateful for. And sometimes you can't think of anything. And then as I start thinking, I'm grateful that I that I have a house. I'm grateful that I have a car. I'm grateful that my kids are healthy. And then all of a sudden you can make as many, it just keeps going and you feel better and better and better.
Absolutely.
But
And I like to do a bookend with that. Sorry if I interrupted, but I just want to add in for gratitude, the attitude of gratitude, and having that gratitude list is to do a bookend. So in the beginning of your day, when you first wake up, just write 3 things you're grateful for. And right before bed, write 3 things you're grateful for. Because now you're starting the day with gratitude, and then you're ending the day with gratitude, no matter what has happened.
That's great. And it doesn't have to be something big. I used to struggle with what should I be grateful for? And you know what? A lot of times on my list is coffee. I love coffee. I'm so grateful for my cup of coffee. When I used to drive a lot before COVID, I was so grateful for the great parking spot. There are so many things we can be grateful for. I'm grateful it's starting to thunder here. And my dog came in.
Nice.
Let me look at my feet, you know? So we can think about, it's all up to us. It's our hands, it's our body, it's our brains. We can do it. We can do it. And it's okay. Change is not linear. You don't decide you're going to change and then you take a straight line and change is here. Change is 2 steps forward, 1 step back, 1 to the side. Oh, we're going to pause and maybe I really don't want to change. Oh, yep. And then you just keep moving forward. And it's okay. It's okay. That's how it works.
It's all about consistent effort, you know. Even if you had a bad weekend, hey, you know, I'm going to wake up Monday, it's a whole new week. Let's do a reset. I'm going to wake up, you know, okay, this month just sucks. So let's go next month. This season sucks. So let's go. Summer starting, whole new things, constant reset. And that's key. That's where we know it's like we still have that drive, you know, that hope. That's so important. And that's going to help us go forward all the time.
Yeah. So let's get to some of these questions. And we have about 20 minutes. So we're going to do our best to get through all of them. And some of them I think we might have answered. What are some good self-care things to do to replace self-soothing behaviors?
Yeah, so that one we want to just make sure the self-care is not the same thing as self-soothing. So what you want to, I would assume that's about what are good self-soothing behaviors we could do to replace bad self-soothing behaviors. And I think we covered some of that. And yes, self-soothing behaviors can serve sometimes as a way to numb, because again, it's all about pain, right? I don't want to experience whatever this is. Anxiety is painful, depression is painful, memories can be painful. You know, if you've had any loss or a death in the family, that could be very painful. So we do things. Some people get into really cleaning things out, and some people get into just writing or painting. You know, there's again that healthy stuff versus the unhealthy stuff that you can use. But it is, I mean, our self-soothing behaviors as a way to numb, yeah, we could do that because we've learned how to do that. It's part of our nature, you know, as a baby. Maybe you're sucking your thumb because of whatever that makes you feel good. So, yeah.
Yeah. And what are self-regulating behaviors? What would you call, that was a question that came in through registration.
Yeah. So self-regulation is about, so we have self-control and then there's self-regulation. And self-control is about inhibiting strong impulses, and self-regulation is just about reducing and the frequency and the intensity. So, and what we do with self-regulation is manage our stress load. And you get self-control by self-regulation. And self-regulation, you have emotional self-regulation, and that you can use some emotional intelligence techniques, you know, self-awareness, internal motivation, empathy, social skills, the self-care, self-soothing. But self-regulation is just like, how do I want to behave? There's behavioral self-regulation, emotional self-regulation. Behavior is about our behaviors. How do I want to help manage how I'm behaving? And part of that, as we're talking about the FRBs, that's a part of the behavior, picking and pulling. So that's emotional regulation is all about our emotional well-being and our emotional responses to things. Do I need to yell all the time when this event happens? Can I actually use my regular voice to express my disappointment? Or do I need to yell? That's that difference. And when you have regulation, whether it's emotional or behavioral, you'll see how much more in control you feel, and that's so motivating. And I am somebody who has used Stoic philosophy to help with all of that. Because Stoicism just says, hey, you know, we don't have control of everything. So you can't control things. You can't control other people. You can't control situations. All you have control of is yourself, your thoughts, your feelings, your emotions, your responses. And that really opens up a door for me to say, you know what, if this person chooses to behave that way, that's their thing. I don't have to take it internally. I don't have to personalize it and then react to it by getting angry. I don't need to escalate it. I have that choice. So that's been really, really helpful for me to take a step back all the time. Even with everything that's going on right now, it can be super overwhelming. But if I take a step back and I'm like, this stuff has been going on throughout all of history, even before my time. It'll continue to happen after my time, unfortunately. But I do so much, you know, so I do what I can do, but I'm not going to sit here and dwell and worry and just overwhelm my senses to the point of exhaustion. And now I don't have any energy to take care of myself. And what does that do for me? That's counterintuitive. It's not conducive to my own health and well-being. And if I don't take care of my health and well-being, I can't take care of my clients. I can't take care of my patients. I can't take care of my family. I can't do my job, et cetera, et cetera.
Yeah. Yeah. And what you said about self-regulation and raising your voice, boy, does that hit home, because all week, I don't want to jinx it, all week we've been having internet trouble. And all week I've been yelling at my husband because he's a tech guy. And my daughter said to me, why are you yelling at Dad? It's not his fault. And
Kids get it.
Kids get it. Kids get it. So let's talk about sugar.
Oh my.
Does sugar have an effect? I know you
my.
might answer this one.
So sugar is so yummy, unfortunately.
Oh, it's so yummy.
So yummy. So sugar has a lot of problems with itself. It really depletes a lot of our nutrients. So number one, we're depleting nutrients. Number two, you're increasing your insulin. Insulin is a hormone in your system that is a part of a variety of other hormonal systems. So if your insulin's off, it's throwing a lot of other systems off. One of them being your cortisol levels. And cortisol is a stress hormone. So as we're doing the little dance, oh, I feel bad, I'm gonna have sugars, insulin spike, and then what's gonna happen is there's gonna be a crash, and then you're gonna have cortisol spike, and then there's a crash. And this, you know, this wave that you ride is a continuous wicked cycle that you can get yourself into. And that creates anxiety. So if you don't have sugar around, maybe you resort to something different, you know, whether it's pulling and picking or anything else that may be unhealthy instead of the sugar. So kicking the sugar habit it will do so much for our just health in general. It also helps our gut because our gut takes in sugar. And guess what? Sometimes that sugar can increase the yeast in our systems. And now we got other problems going on. So yeah, sugar has a lot of detrimental effects on our gut, our mental health, our entire physiology, and the chemicals in our brains, because it's just constantly giving us a spike of something, whether it's a dopamine spike, whether it's a serotonin spike. Yes, great, fantastic, but it's very temporary. And again, the temporaries don't help long-term. And that's what we need to look at when it comes to sugar. So I know sugar is everywhere. It's put in everything out there. As far as any packaged product you pick up, it will say some kind of sugar. Whether sugar added or not, there are products that still have sugar in them. So if you have like dried fruit, that still has sugar. The brain doesn't know if it's the healthy sugar or regular sugar. It still is going to respond the same way by spiking our insulin levels. So that's like a whole other webinar to itself.
Yeah. Well, speaking of chemical reactions, why don't we go into the next question, which is insights and info on trying medications. And I know that there's, and neither of us are psychiatrists, but I'll defer to you, Dr. Wagner, and your insights on this.
Yeah, so I have a postdoctoral Master of Science in Psychopharmacology. So I did a little more training in that. So medications are very, very interesting. Specifically for BFRBs, there isn't a whole lot of good outcomes or research out there as far as what helps, but it doesn't mean that it doesn't help, right? For some people, it's amazing. It could help. For others, it didn't do anything, but it doesn't mean that we give up. Not just on, you just don't give up. If the medication doesn't work, I say, forget it. This is how I'll always be. We have to try other things. We could try change in diet. We could try adding exercise. We could try cognitive behavioral therapy. And these are other ways you can actually get some assistance. Now, medications themselves don't change your brain as to how it functions and works. It's just a chemical that goes in, and it either prevents an upsurge of it, or it actually increases a certain thing, you know, like serotonin or dopamine or your endorphins. And the problem with medications is that once you're off of it, the behaviors come back. Mm-hmm. And that's why brain training, you know, like habit restructuring, thinking differently, learning cognitive behavioral techniques is how you're actually going to change the wiring in your brain. Chemicals don't do that. And we have a saying, you know, neurons that fire together, wire together. So if you're doing the same thing a certain way, well, your brain's going to learn, it's like, this is how I'm doing it. Now, when you want to change, you have to do a different thing a certain way. But so being consistent and always going to that, now you're going to have that behavior change. Now, again, the efficacy rate for antidepressants is probably like 33%, not a whole lot. Don't quote me on that, but I mean, that's the latest that I had read. Some people say it's about 66, some research, but it just depends on the individual. And I think the unfortunate part of medication is the side effects. And that's why some of the people don't stick with medication, because of all the side effects that come from it. And but it doesn't mean, go ahead.
Aren't you referring to the efficacy not for BFRBs, but for other?
Right, for other, right. BFRBs, that is not, it's actually a lot lower.
Itself, the SSRIs and the antidepressants and anti-anxiety medications that are being used for OCD and depression are not useful with BFRBs.
Absolutely. Yeah, and that's a problem.
Yeah. But there is the NAC.
Yeah, the NAC, which is N-acetylcysteine, and that's just an amino acid, and that seems to have a higher efficacy rate than the antidepressants or anti-anxiety medications for BFRBs. So, I mean, it's a supplement. It's worth a shot. It can't really hurt you. I mean, there's not a lot of information that does anything damaging to your system. It's just an amino acid, and it doesn't hurt to try that. I mean, I have it in my cupboard, and I have to get into using it consistently to see if it actually does help me or not. So it's, looking at your supplement, and just make sure that you have, you know, your vitamin C, vitamin D levels, magnesium. There's a lot of supplements that the micronutrients that we may be missing that we want to look at too, because I know for me, if I don't have my probiotics, because I have an autoimmune disease that has impacted my gut, I have to have my probiotics. And if I don't have it, then I notice that, you know, maybe there's a little depression, maybe there's more anxiety, and I need to address that. So you can do it with foods or supplement and see how you feel. And the best way to look at that and see if it works is to start noticing, doing the baseline of where you're at now while you're on the supplement, and then stopping the supplement, see what happens. So monitoring it would be really a great way for you to know if something's working or not.
Right. And if anyone out there wants to try it, you might want to check with your pediatrician or internist before. There are studies out there for NAC that it helps in about 50% of the cases. I tried it. It didn't work for me. I do know other people have used it and it does work for them. It doesn't do 100%, but it might help take the edge off. And that's something you can choose if you want to try. So the question about how to stop behavior without using the Keen bracelet, everything we talked about is something you can use. The Keen bracelet is just it's awareness. So you can't change something if you're not aware. So what the Keen bracelet does is it just makes you aware that of where your hands are, so that you can then decide, what am I going to do next?
Yeah, the Keen bracelet is fantastic. It's a brain training tool, and it's amazing, because when I first used it, I was like, oh my gosh, this thing is really working. So every time it's like, it vibrated, I go, oh, I'm not supposed to put my hand there. I'm not supposed to put my hand there. And so the brain starts picking it up. So I didn't use it for a few days and I still was thinking, oh, I'm not supposed to put my hand there. So it's amazing how it doesn't take that long. Yes, there are maybe false positive vibrations that could happen. And that requires some work and training. And Ellen was wonderful enough to tell me, it's like, oh yeah, maybe train one area at a time instead of doing 3 or 4 at a time, where the things like, what's happening? But it's really, I think this is like a wonderful way to train the brain without having to beat yourself up because you can't do it or you don't have the willpower.
Yeah. And it's true. And while I don't want this webinar to be a commercial for Keen, and if anyone has any questions about it, you are welcome to please email me. I know Mari put my email and we'll put it up at the end. But the Keen bracelet is an amazing tool to help you be aware. And the whole goal is to be aware of where your hands are so that you can retrain. And it really, so let's move on to the next question because that actually kind of goes into it too. So someone had said, I recently shaved my head in an effort to reset myself. Both of us are going to answer that. I'm going to just take the beginning part where just because you remove something doesn't mean you remove the behavior. So if I broke my hands, God forbid, and I was in casts, I wouldn't be able to pull my hair. But that doesn't mean that I'm not going to have trichotillomania anymore. I still haven't trained my brain. I haven't trained my behavior in order to not do it. A lot of people with hair pulling, if they might have hair replacement, where they wear a wig or they actually have, they go to like Lucinda Ellery and they have the hair put on that they can't take off and their hair grows underneath. And what happens is when their hair grows back and they take the hair replacements off, they pull their hair out because they haven't had the training to replace the behavior. So, and I know you wanted to talk, Dr. Wagner, about reset, because reset's important. Shaving your head is still an amazing thing because then you kind of have a clean slate, so to speak, and then you can begin to use the replacement behaviors. But just shaving your head isn't going to do it.
Right. It's just like when so I am a nail picker, so I then would go and get nails done, right? Put nice nails on so I don't have to pick too much. But then what happened was then my hands went to my face to start picking my face.
Yeah,
and then as soon as you take the nails off, the hands go back into picking the nails. So it's a replacement, one area from another. So we have to be cautious of that. I love the reset of anything, right? I mentioned it earlier. And maybe now that you have shaved your head, you can start working in crowding in the healthy self-soothing behaviors so that by the time your hair starts to grow, you have these tools and techniques you're already using. So you're not motivated to start the picking again. Or if you do, again, it's a management, right? So if you do, it won't be as frequent or as intense. So, any way you want to just take something and reset and motivate yourself to do a change, right there, we know you want to do it. And right there is fantastic for just having that hope. It's like, I want to get better. I have this motivation to get better and I'm working on it. And that's all we can do, So if it works, it works. Just be aware that it's not like you're going to completely be rid of it. It's just a management that we have to do. And it's okay to have these resets. Even if you need to do it 100 times, it doesn't matter.
And resets are wonderful. I will do a reset where, I'm working, my desk is a mess and I'm procrastinating, which I didn't even think about it as one of those unhealthy self-soothing. I'm a big procrastinator. And so for me, a reset could be taking every single thing off my desk, wiping down my desk and only putting back what I want. And that's my reset. But then I also need to do the work in order to get the work done. So shaving your head or shaving another part of your body in order to help is an amazing thing to do. Just make sure you take that next step, because just cleaning off my desk, not to continue to procrastinate, isn't going to help me.
Yeah, and I want to make a quick note about the procrastination. We're such a doer society, and then if we don't do things, we get on our case and have negative comments about ourselves, negative self-talk about, look at so-and-so, they are like, their house is immaculate, my house is a mess and all that. sometimes we just want to be aware it's okay to not do things. Okay, sometimes it's okay to take time off and just be and relax. So I don't want to say procrastination is 100% bad all the time. It's when it consumes everything and you really aren't getting anything done. That's when it's a problem, and that's when it's like an unhealthy self-soothing. But I have a lot of paperwork, but I've worked hard all week and I'm tired. And the type of work I do, working with PTSD and trauma can be exhausting. So you get the compassion fatigue. And of course, with everything else going on, I'm empathic, so I pick up all that stuff. I just need to chill out. So I play like online jigsaw puzzle. I do a jigsaw puzzle online. That's my escape time, but it shouldn't overconsume everything where I don't get to my paperwork at all, or just don't get to the things I need to do for self-care. So, but once in a while, having that little relaxation time is totally fine, but it doesn't mean it's procrastination. So we want to differentiate procrastination and relaxation.
And mine was totally procrastination, because then I wouldn't do the work and I'd be searching for shorts.
Yeah.
Over and over and over again. So, but I'm glad you said both pieces, because they're both equally important, because we are a go, 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 and we do need to relax. So we only have a few more minutes. On the last question, how to help a loved one with BFRB, if you would, Mari, put in the chat, and I'll send this out. I did a wonderful webinar specifically for how to help a loved one with BFRBs, because that's a whole webinar in itself. And if you go to www.habitaware.com/parents, that's the redirect, and it'll get you to the webinar. And also, sneak peek, I'm writing a book that Mari's helping me with, that's going to come out soon. And we're also going to have a course too for how to help loved ones with BFRBs. So, and I know that we didn't talk about the Keen bracelet. And what I did want to remind people, and I will send it out, is that I do group trainings every week. I alternate the times. Next week's will be, I think it's 2 o'clock. I'll have to triple check Eastern time. Yes, I know it is. I do them on Thursdays, 2 o'clock Eastern time and 7 o'clock Eastern time alternatives. And if anybody wants to come to the group training and ask questions because you're interested in purchasing a bracelet, come on. And if you want to schedule time with me, ellen@habitaware.com. But here's how you can follow up with both of us. Here's Dr. Lily Wagner's information, and here's my information. And is there any last things that you wanted to mention about if people wanted to reach out to you?
I noticed one of the questions was about the web. One of the questions was how they could listen to that podcast, and I just posted the link in there in the chat room. Awesome. Just go to my website, to the media, and there will be a link for that specific self-soothing versus self-care podcast that somebody was interested in. And
it's a great one.
Yeah,
absolutely fantastic.
Thank you. And yeah, if anybody has any questions or wants to reach out, I only work with patients that are in California. If you want psychotherapy, but I do coaching globally. So if you need to reach out or ask, how do I find a therapist, a good therapist, I don't mind. Just shoot me out an email, go to my website there, or you have the email right there too. I would love to chat and help out however way I could. And if I can guide someone to the correct individual, that would be amazing as well.
So thank you, everybody, for spending the hour with us. This was so much fun. I could keep talking. And I'm thrilled that we got to do this, Dr. Wagner, and I'm so glad, Mari, you were here. I think you just might have to come to all of them now. And if anyone out there has other things that they want us to talk about for future webinars, please put it in the chat. Send me an email, ellen@habitaware.com. I want to continue to have these conversations and just help everybody out there.
Wonderful. Thank you so much, Ellen, and very nice meeting you, Mari. And thank you, everyone, for listening. I think these are wonderful webinars, and it's good to have a community that you can tap into and get some information from.
Yeah. So everyone have a great Friday. Wish my husband happy birthday.
Happy birthday, hubby.
All right, we're signing off. Thank you. Bye, everybody.
Bye.